If you're a medical professional looking to build income beyond the clinic, you're in the right place. Go ahead and hit that like button, subscribe to the channel, and follow along. Because each week, I share practical strategies to help turn your expertise into influence and income. Now, let's get into today's topic. Most people think you need to be famous, published, or connected to get paid as a speaker for pharmaceutical companies. But the truth is, you don't. If you're a licensed medical professional and you can clearly explain how medications fit into real-world clinical practice, you already have what companies are looking for. Now, what you may not have is a roadmap. In this video, I'm going to walk you through 5 practical steps to help you become a paid pharmaceutical speaker, even if you're just starting out, have zero speaking experience, or have no idea where to begin. Let's get started. Here's something most clinicians don't realize. You don't need to be a national expert or publish in journals to qualify as a speaker. Pharmaceutical companies want credible, practicing clinicians who can explain their treatment experience to peers in an educational and compliant way. So that means if you're seeing patients and you're staying up to date and you have the ability to present clinical material clearly, you're already a strong candidate. So what matters most is that you treat patients who would benefit from the company's product and that you can speak to how it fits into standard of care. So stop thinking you're not ready. If you're practicing medicine, you're already ready. You just need to position your experience the right way. So now that you're owning your voice, let's talk about finding opportunities. So you start by looking at the top 5 medications you commonly prescribe in your specialty. Visit the websites of those pharmaceutical companies and look under their medical affairs or professional education series. You can also start looking on LinkedIn using phrases like medical science liaison or speakers bureau along with the company's name. If you work in a clinic or hospital and you're seeing pharmaceutical reps, ask them directly, does your company offer any promotional speaking opportunities? I'd be interested in learning more. That's a great way to open up that conversation. Now, you'd be surprised how often that one question leads to a referral or the next step. So once you've identified who to reach out to, you need a professional speaker CV, one that highlights your credibility, your clinical focus, and your communication skills. Now, this is not your typical academic CV with every poster and publication. This is a tailored, concise CV that emphasizes your medical degree, your specialty, your years of practice, and your current role, the types of patients you see, and any speaking experience, including CME talks, grand rounds, or community lectures, and also any clinical research experience that you have. A short paragraph on your interest in peer education and adherence to industry compliance standards. So you want to keep it to 1 or 2 pages. Add a clean headshot and your contact information, and that's it. Bonus tip, if you don't have speaking experience yet, list any teaching, mentoring, or educational leadership roles. These still demonstrate communication skills. Your speaker CV is your first impression. Make it count. Now, your first pharmaceutical talk will likely be a small dinner event or a virtual session, or it could be maybe a lunch event. So it may be just one rep and a few colleagues. That's okay. You're starting out small. What matters is how you show up. So you'll want to stick to the approved slide deck, be clear, be concise, share real-world insights, and stay compliant with the FDA guidelines. Be easy to work with. So these early talks are your audition, not just for that rep, but for the entire region. At the end of the event, ask the pharmaceutical rep something like, if you think this went well, is there someone else I should speak with about future programs? So this opens the door to repeat events, regional programs, and even national opportunities over time. Now, pharma speaking can be more than an occasional side gig. With the right approach, it can become a predictable income stream that complements your clinical practice. So once you've spoken for one company, apply to others within your therapeutic area. Diversify. Build relationships with multiple reps and medical liaisons. Keep track of your speaking dates, prepare well, and always show up professionally. Now, you can also position yourself on social media sites like LinkedIn as a medical educator. Make your profile reflect your interest in peer learning, evidence-based care, and improving patient outcomes. Now, over time, you may be invited to serve on advisory boards, participate in clinical trials, or speak at national meetings. And yes, these opportunities can be compensated generously. So let's quickly recap the 5 steps. 1, own your clinical voice. Your real world experience matters. 2, identify the right pharmaceutical companies and contacts. 3, craft a professional speaker CV that positions you as a peer educator. And 4, start with strategic opportunities and ask for referrals. And 5, turn speaking into a repeatable, scalable system. Now, you already have the knowledge, you already have the credential. Now it's time to share your voice and get paid for it. Now, don't forget to like this video, subscribe to the channel, and turn on notifications so you never miss an episode. Your voice has value. Let's turn it into influence and income. See you in the next video.